My name is Lindsey Madrigales, and this is my PowerPoint titled, Should Healthcare Workers Be the First to Receive the Vaccine Compared to Non-Healthcare Workers? Now, essential workers, we've heard of them, but what is one? Well, these are workers who are required to fulfill their duties even during hard times, and an example could be COVID-19. Now, when it comes to essential employees, there are 14 categories, and those include healthcare, first responders, and food and agriculture. Some examples of essential workers are dentists, psychologists, nurses, and nurse assistants. Manufacturing workers would include biotechnology companies, materials and parts suppliers, and distributors of medical equipment. Now, a non-essential worker, what is one? Well, these are workers who aren't required to, in other words, you could say work. As we all know, most non-essential employees have been laid off due to their business not making enough money. And other companies have been making their workers work from home to slow the spread of the virus. Some examples of non-essential workers would include hairdressers, waiters and waitresses, and florists. Now, coronavirus, what is it? COVID-19, short for coronavirus, is a respiratory illness which has crown spikes around it. The most common symptoms of COVID-19 you'll hear are fever or chills, shortness of breath or difficulty breathing, and lastly, new loss of taste or smell. If you start experiencing trouble breathing, pain in the chest, it is best to go to the hospital. Now, when it comes to COVID-19 symptoms, they're very similar to a cold and a flu. So if you start feeling any of these, it is best to go get tested. Some measures you could take to prevent COVID-19 are wearing your mask when out in public, practicing social distancing, and constantly wash your hands. And when you go out, when you know you're going to be out for a good while, take a bottle of hand sanitizer with you. And this is obvious, but if you start feeling sick, stay at home until you feel better. Now, when it comes to the test for COVID-19, there are three, and the first one is the molecular test, and this test is approved by the FDA, and it could tell you if you currently have an infection by looking for the virus that is taken with a nose swab, throat swab, or saliva. And these results, you usually get them that same day or up to a week. The second one is the antigen test, and this one's done the same way, no swab or throat swab, but this one tests for viral proteins, and this one is 15 to 30 minutes, depending on how fast the test was done. The last one, the antibody test, it's done differently. It's done by finger prick or drawing blood from the vein. There are 4 phases of the vaccine process, and the first one is where everything begins, where they give the vaccine trial to a small amount of people. The second phase, which is where they give the vaccine trial to people who are more prone to getting the virus. Phase 3 is when they test the effectiveness of the vaccine on a bigger group of people. And the last phase is where it gets approved and licensed. Distribution of COVID-19 vaccine. A checklist was provided by the CDC saying who would get the vaccine first, and it was said that healthcare professions, national security populations, and long-term care facility residents and staff would be the first one to get it. A meeting was held by health experts who said that when it comes to vaccine, there'll be more than one. Now, with the knowledge we know, we can restate the question of why essential workers should be the first one to receive the vaccine. Well, first off, healthcare workers are most at risk of catching the virus because they're very close with the patients. And second of all, essential workers are scared from themselves and their families and are putting their life at risk and may bring the virus home with them. Methods I used was I read 6 articles, and the first article was about the wealth status of participants. The Article 2 and 6 followed the vaccine process. Article 3 and 4 asked CDC who would get the vaccine first. Article 5 followed vaccine trials. And my references, and I would like to thank Dr. Gonzalez and my mentor, Javier Villagomez.